Welcome back as we continue to live in this new pandemic world and still kind of finding our way through COVID-19. This morning, we are drawing our attention to emergency room visits and how Advent Health has actually come up with a new system in making sure that our ER rooms are staying safer and making sure that you get the care that you need when you need it. And that is why I'm so happy to welcome in Dr. Barrick this morning, who is on the front lines in our emergency rooms these days. And we cannot say thank you enough to you and your team, doctor, for all that you are doing. But let's talk about emergency room visits. And I know first and foremost, the message is if you have a true emergency and need help right away, the ER is still where you need to go first.
That is 100% accurate. It is the safest and best place for you to be, for sure. What Advent Health has done is they've created a software tool called InQuicker. What that does is that enables an individual to log in to getinquicker.com. You register yourself, and when you have a circumstance where you need to be seen in the emergency department, you're actually able to go online and reserve a place at the Advent emergency room to be seen. Now, clearly, we want to make sure that these are non-life-threatening emergencies. Things like sprained ankles, upper respiratory, coughs, things like that. That's what it's designed for.
So how does it work? Do you still call 911? Do you go to the website first? Do you call your doctor? I mean, again, because when you're in the middle of an emergency or you have a family member that's in pain, we sometimes kind of forget, okay, calm down. Here's what we need to do. What's your advice?
So obviously 911 is always your go-to. However, if you have a circumstance where you need to be seen, but you're not sure if it's truly an emergency but you want to be seen, you go to the platform, the InQuicker platform, and it's a robust process. It actually will identify your complaint, and if your complaint is something like chest pain, stroke-like symptoms, shortness of breath, it will actually flag and notify you that you need to call 911 and go to the nearest emergency department.
What message do you have? Again, this is a new world that we're living in, and I feel like health news changes so almost daily these days. What is your message for families watching today and kind of we're in this unpredictable climate?
Yeah, absolutely. So as you said perfectly, the climate changes on a daily basis. Advent Health is truly leading in the forefront of creating a safe environment for practitioners, myself, our teams, and also for the patients. For example, when a patient presents to the emergency department, they are given a screening process which identifies, based on CDC guidelines, potential risk for having a COVID infection. If they test positive or they're screened as positive, they go to a secondary tenting area where they are triaged. If they need to come to the ER, they enter the ER through a separate entranceway. They are taken to a specific set of rooms that are earmarked for that particular risk. They're separated away from the rest of the emergency department patients. And this is done specifically to prevent that risk of crossover. In addition to that, obviously the rooms are all sanitized, hand washing, social distancing, doing all the things that make the environment safe. And people are having heart attacks on their sofas because they're afraid to go to the emergency department. So it's critical that we continually enforce that the ER is the safest place for you to be.
And I hope it's okay if I ask this too, but I know there's a lot of questions on who can go to the ER as far as loved ones. But, we're also trying to limit the number of people that go to places. Is that a message that we need to get out too? I mean, are you allowed to at least have one family member with you? Certainly if you're in the middle of an emergency, not bring certainly the whole family. What would you advise there?
Yeah, we do restrict our visitation, and that is done very specifically to decrease the risk of transmission to those that are there in support. Now, there are extenuating circumstances, end of life, OB patients that are having babies and so forth. But generally, we really work diligently to restrict having anybody be exposed or at risk, including PPE, protective gear. Advent Health we have an ample supply of for both myself and our teams that are on the front line, but also as importantly is for our patients and our guests to make sure that, they're not risking contaminating us and we're not risking contaminating them. So Advent, again, is really leading the pack in that regard.
Well, Doctor, again, we can't thank you and your team enough. I know you guys are putting in long hours. We appreciate it. Thank you for taking some time with us today to help spread this message. We've been showing that website, this new platform on how you can get people in quicker and certainly getting the help that they need. Doctor, thank you so much. We appreciate it. We'll make sure this goes on our website too.
Awesome. Thank you for the time. Appreciate it.